Ciao mondo, hello world, hola mundo, hello monde. We are here today in Vicenza during the International Vicenza course on critical care nephrology, and during one interruption I was just reading an interesting paper from blood purification from a group of Zhongqin in China. Liu is the first author that made a comparison of transplant outcomes in patients in peritoneal dialysis and hemodialysis. What they did, they used the meta-analytic method to study different potential outcomes in patients doing hemo or peritoneal dialysis. Of course, they searched PubMed and Bayes and Cochrane registries, and they found studies that led us to conclude that today, in the pre-transplant moment of a patient, peritoneal dialysis is probably superior therapy compared to hemodialysis. Why? Well, because probably the PD patient is always ready, the hydration status is optimized, the solute removal and blood purification therapy is optimized, and indeed this patient may present better outcomes in long term, especially as regard as delayed graft function. In fact, patients on hemodialysis had a higher incidence of delayed graft function compared to peritoneal dialysis patients, although in the long term, graft survival and patient survival were not different. So in blood purification, this excellent paper is now marked with the Cappuccino with Claudio Ronco logo, and I invite you to read this meta-analysis that concludes at the end. We found that peritoneal dialysis was a better choice of pre-transplant dialysis modality than hemodialysis. Once again, comparison of PD and hemodialysis seems to bring up the importance of peritoneal dialysis as a chronic renal replacement modality. And I think this paper once more stressed the fact that in patients that are listed to be undergoing kidney transplant, the possibility that PD is superior is highlighted. With this, I thank you very much for joining today Cappuccino, and I invite you to read the current issue of Blood Purification.